Welcome everyone to this webinar on understanding benign breast disorders. My name is Gareth Falls and I'm a consultant medical herbalist, and I'm here to explore various benign conditions that affect the breasts, their symptoms, their causes, and both conventional and herbal treatment approaches. Now the caveat here is if it's not benign, if you suspect that this is cancerous, then I would suggest you go on to the Cancer Hub, where I will cover breast cancer in a lot more detail. Now, benign breast disorders are common and they can cause significant concern due to their symptoms, such as a lumpy or rope-like breast tissue and painful breasts. These conditions, which include fibrocystic breasts and fibroadenomas, are not cancerous, but they can often be alarming due to the fear of breast cancer. And it's important to note that breast pain or mastalgia, as it is medically known, is not generally associated with breast cancer. Most breast lumps are benign. So types of mastalgia. This is breast pain that can be categorized into two types. There is cyclical mastalgia. This is a type of pain that's associated with PMS, just before on the run to your bleed, or indeed just at ovulation. And it can often be tender, dull, heavy. It's on both breasts, so it's termed bilateral. And it typically affects the upper and the outer parts of the breasts that can radiate into the upper arm. There's non-cyclical mastalgia, and this pain is constant or intermittent, and it can be on one breast as opposed to in both breasts. It can be localized with no clear underlying cause, and the possible causes can include pregnancy, mastitis, trauma, macrocysts, benign tumours, and indeed cancer. And interestingly, it's not just females that suffer this. This is a condition that does affect men as well. Now, a thorough breast examination should ideally take place after each and every menstruation, especially if your breasts are painful. You might not be able to do it during the bleed, but after menstruation, it might be possible to palpate them properly. And there's a number of different ways to do that. You can look at it almost like cake, and how you slice a cake into quarters and then eighths, and then take each section of the breast and work your way across the breast in those segments. You might want to look at the breast and go just up and down all the way over the breast, over the areola, and right in under to the armpit. Or indeed, you can go in circles from the nipple and work around and to the outside. There's no specific way. It's very much down to you as the person examining the breast as to what you prefer. What are you looking for whenever you are doing this? You're looking for symmetry between both breasts, that they look the same, they feel the same. If you place both hands on your hips and then both hands on your forehead, check to have a look at the nipples. Are they inverted? Are they retracted? Is there any discharge, any crusting, or is there any skin changes like dimpling, edema, rashes, any scaling, or any ulceration? That's whenever you're looking at it. Then it comes on to the palpation. And whenever you're palpating, it involves gently assessing the breast tissue. So you're starting with the painless breast or the painless areas, and you check the tissue where there is no pain, and you check beneath the breast and beneath the armpits into the lymphatic tissue. A referral is necessary, or indeed going to see a professional is necessary if it's non-cyclical. So if this is not to do with your menstruation, if it's in one breast, if it's irregular, and there's a palpable mass that is stony and hard, that feels different from the surrounding areas, it's generally going to be fixed if it needs to be referral, or on the chest wall, or it will present with nipple discharge. So if any of those things happen, it's a red flag. That means you need to go and see a consultant and ensure that you get the proper diagnosis. But let's review some of the more common benign breast conditions and what can be done about it. So cysts. Cysts are smooth. They are mobile swellings that will move around the place. They're rubbery, and they're usually in the upper quadrants or the central margins of the breast tissue. And the pain is localized, so it's not going to spread anywhere. There is duct ectasia. So this is pain that is felt behind the nipple with a possible green or yellow discharge, and the nipple may be retracted. You can have fat necrosis. So this was usually found in one breast, and it's a condition that results in a hard, irregular lump that sometimes is accompanied by bruising and often happens due to trauma. There's fibroadenomas. These are common in women aged 20 to 40, and these lumps are smooth, solid, and movable. They are typically painless, but can grow and are sometimes need to be removed. And ultimately, this is one of the ones that even if it moves, but it doesn't move much, you definitely want to get it investigated. Fibrocystic breasts are usually occurring in women aged 30 to 50, and it's pain or a condition that subsides after menopause, but it can be exacerbated by HRT, and the lumps are symmetrical. They are nodular and they have like a rope-like feel to them, often with thickening in the upper outer breast area. There's the galactoceles, and these occur in lactating women. A woman that has smooth, round, mobile swelling, and they can appear up to 6 to 10 months after lactation stops. There's intraductal papilloma. It's a small nodule behind the areola of the nipple, or just around the nipple, and it may cause a bloody discharge. Other conditions that can happen are large breasts, which can cause diffuse bilateral pain and quite often pain in the back. You can have lipomas, which are soft, lobulated swelling. There's the malignant carcinoma. So this is typically found in women over 60 presenting with asymmetric, hard, irregular swellings that are fixed to the skin or deep in the tissue. Often there's no pain or discharge, but the nipple may be retracted and the lymph tissue may be swollen. There is mastitis, which presents with severe pain, with swelling, and with erythema. This is a bloody red rash. Phyllodes tumour is a mobile lump that can grow large and grow quickly. There's a sebaceous cyst, which is a small mobile swelling fixed to the skin that can become infected, red, and indeed ooze. Generally speaking, whenever it comes to assessing breast tissue, the investigations are going to include a palpation, a mammogram, an ultrasound. There may be biopsies, and pregnancy tests may be taken if the pain persists for several months. Generally speaking, from a conventional point of view, you would be given NSAIDs. Now, this is anti-inflammatories that are non-steroidal, such as ibuprofen or paracetamol to manage pain. You might be given tamoxifen or oral contraceptives, which are discontinued if they are associated with symptoms. So these may help the condition, but it may also cause them. Fine needle aspiration can sometimes be used to drain fluid from a cyst or resolve discomfort. So breast tissue is responsive to hormones, particularly estrogen and progesterone, which are clearly associated with most of these disorders. Prolactin secretion, which is another hormone, increases sensitivity to estrogen, and fluid retention also plays a role. Thyroid function can influence hormone levels, and there's a noted increase in benign breast lesions among postmenopausal women taking estrogens and progesterones. So this is in the HRT or combined pills or coils or IUDs. On the other hand, those people who are taking anti-estrogen medication will see a reduction in these lesions. So clearly estrogen has a role to play. Now, herbal treatment approaches. The herbal treatment focuses on reducing pain, reducing the congestion in the breast tissue and fluid retention. We also want to address hormonal imbalances, reduce the stress, and as a result of that, there's a number of herbs that are familiar to us. To aid digestion and the microbiome, and we would use bitters to improve nutrient absorption. Now, the reason that we want to aid digestion and the microbiome is because estrogen, if you're constipated, will sit in your stool and get reabsorbed by your system, leading you to an estrogen dominant state, and that can exacerbate what you have in relation to the lumps in your breast. We want to ease fluid retention, and there is very few better herbs than dandelion leaf for this. We want to reduce congestion. So this is the lymphatic herbs such as calendula, this is marigold, cleavers, pokeroot, and thuya. We want to reduce excess estrogen in your system. So dandelion root is really wonderful as a hepatic herb to move the liver and the gallbladder. Milk thistle and flaxseed works as a phytoestrogen and also to bulk up the stool and make sure that you're going regularly. We want to reduce the amount of prolactin, so peony and licorice used together in this instance are very effective. Vitex, Agnus castus, or chasteberry and black cohosh are also useful at reducing prolactin on the dopamine pathways. We want to reduce stress, and we would use herbs such as gotukola, schizandra, motherwort, lemon balm, and verbena. We may also want to improve circulation, and a herb such as ginkgo biloba or ginger is really helpful here for this. Moving on to diet and lifestyle recommendations. So a diet should be rich in fruits, vegetables, nuts, and seeds, which is associated with reduced risk of proliferative and atypical breast lesions. So it's certainly worth considering increasing your consumption of fruits, vegetables, nuts, and seeds. Reducing the amount of caffeine that you take is also beneficial. And exercise, swimming, particularly the breaststroke, is helpful at improving the ligature in and around the breasts and providing support and reducing discomfort. Now, supplements are next up. And supplements that you would consider would be things like iodine if you suffer from hypothyroidism, but not if you suffer from Hashimoto's. NAC is helpful at reducing mastalgia pain and PMS symptoms. Vitamin A, this is at 150,000 IU, has been shown to clear symptoms and reduce pain in benign breast disease. Not suitable if you're trying to conceive or if you're under 18. Vitamin B6 and vitamin E, along with wheat germ, are taken from the 16th day of the cycle to the 5th day of the next cycle to try and alleviate any menstrual breast tenderness and pain. So in conclusion, we are able to treat benign breast disorders, which are very common and usually not a cause for an alarm. It's about understanding the symptoms, understanding the condition, and the treatments that are available to you, both conventionally and herbally, and how to manage those disorders as effectively as you can. Now, if you have any questions about this, you can put them onto the community forum here at the Wild Sage website, or you can contact me directly at thewildsage@proton.me. There is a handout that comes after this video, which will have a little bit more information for you to look at and read up on. And if you have any difficulties trying to figure out what you want to take or how or when, then what you can do is you can touch base with me and I'll give you a bit of direction. Or if you want to book a consultation, what we do is we discount the course entirely whenever you come to meet me for a consultation, and that can be done online on Zoom or in the clinic. Hopefully that's of help to you, and I shall see you again soon.